Detecting lesions of ischemic osteonecrosis in the jawbones of living people has been difficult without specialized techniques. The appearance of these lesions on normal, two-dimensional periapical or panoramic radiographs is often indistinct. However, once we get used to the idea that the jawbones are particularly likely to be affected and our eyes become alerted to looking for ischemic lesions on normal x-rays, we can begin to see the lesions everywhere. The vast majority of these very common lesions are not painful, but the very fact that we know the bone is not normal leaves us with a question such as, should we consider them pathological? Should they be subjected to some form of therapy? Can they have an impact on the person's general health?
Specialized imaging techniques. The appearance of ischemic osteonecrosis lesions in the jawbones on normal two-dimensional periapical or panoramic radiographs is often distinct. These lesions can easily be ignored as variants of normal when we're not on the alert to look for them. You can see in these two dramatic examples from the autopsy series that the radiographs may not show any evidence of the osteonecrosis that actually exists inside the bone. Ischemia on 2D radiographs. Radiographic features that were considered variants of normal or merely unexplainable can be recognized as being of ischemic origin when we get used to that idea. Normally, an extraction site should completely remodel and heal in 6 to 12 months. The following images suggest that the sites are affected by ischemia to a degree that the full healing is impaired. In this first radiograph, radiolucency with indistinct borders at old extraction site. Old residual socket with ghost marrow. Multilocular radiolucency with indistinct borders at old extraction site. Old residual socket with ghost marrow. Radiolucency with indistinct borders at old extraction sites. Radiolucency with indistinct borders at old extraction. Radiolucency with indistinct borders. Multilocular radiolucency with indistinct borders at old extraction site. Radiolucency with indistinct borders at old extraction site. Old residual socket with ghost marrow. Old residual sockets. Radiolucency with indistinct borders. Hollow tuberosity. Diffuse condensation. Bone scans. Technetium-99 or SPECT bone scans are used to find areas of the skeleton where bone is either being formed or destroyed more actively. The osteonecrotic region, where mineralized crystals are more exposed, attracts the 99M TC bisphosphonate tracer more avidly than surrounding normal bone. Some amount of blood perfusion is necessary. Occasionally, there will be an image where the affected area is wider than normal, indicating no circulation at all. Thermography. Thermographic imagery can be used to give evidence of a general region that is under stress, inflammation, or infection. There seems to be a phenomenon of increased circulation around an area that may be affected by diseased bone. Cone beam tomography. Of course, our new age of cone beam CT imagery gives us a better view of the contents of the marrow spaces. We can find condensing osteitis and cavitated empty zones with much greater accuracy than ever before. This is a particularly clear example of a residual hollow in the jawbone where a lower third molar had been extracted years before. The numbers are Hounsfield radiographic density measurements, which are produced by many cone beam computed tomography systems, or CBCT, software packages. Often the Hounsfield scores will resolve an area of reduced bone density better than the graphic appearance. Cavitat. Until the company went out of business in 2005, there was a through-transmission ultrasound system available called the Cavitat. The system was based on the fact that dead bone, with its disconnected trabecular structure, could not conduct sound the way intact bone does. A signal generated between ascending and a receiving contact held on either side of the alveolar process would be converted to a three-dimensional image of the volume of jawbone. Damaged bone was rendered in red, while normal bone would be seen as green. Some very useful clinical and research work was done with this instrument, and its absence has negatively impacted further work in this area. The McMahon-Ratner method. The McMahon-Ratner method is for detecting lesions by administration of the inferior alveolar nerve block.